Okay, so good afternoon, everyone, and welcome to the Med School Mentor Leaders in Medicine webinar series. I'm Camila Velasco, Assistant Director of Media Relations, and it's great to have you here with us this evening. Today, we are honored to be joined by Dr. Ellen Eyre, who is the Chair of Neurosurgery at Henry Ford Health. From our Med School Mentor team, we have Clayton, Marcelo, Annalisa, and Sharon. So before we begin, I'd like to take a moment to spotlight our Leaders in Medicine series. Over the past months, we had the privilege of learning from outstanding leaders, each sharing their perspective on how mentorship and leadership have influenced their path. And today we are honored to carry that tradition forward with Dr. Eyre. So it's an honor to welcome today's speaker, Dr. Ellen Eyre, Chair of the Department of Neurosurgery and Co-Medical Director of the Neuroscience Service Line at Henry Ford Health. Dr. Eyre is an accomplished functional neurosurgeon, educator, and leader whose career reached clinical excellence, research, and advocacy. She completed her MD, PhD, and neurosurgery residency at the University of Cincinnati, followed by fellowship training in epilepsy, movement disorders, and pain at the University of California, San Francisco. Her experience centers in functional neurosurgery, particularly deep brain stimulation, where she has advanced both awake and sleep techniques, intraoperative MRI guidance, and innovative neuromodulation strategies for movement disorders and epilepsy. Beyond her clinical and research contributions, Dr. Eyre has served as Residency Program Director at Henry Ford and currently is the Interim Chair of Neurosurgery at Michigan State University College of Human Medicine. She holds officer roles within the North American Neuromodulation Society and the American Society for Stereotactic and Functional Neurosurgery, and has served as President of Women in Neurosurgery. Today, we are privileged to learn from one of the foremost leaders in functional neurosurgery. Thank you, Dr. Eyre, for being here with us today.
Thank you so much for inviting me.
Okay, so let's start. So our first question will be that now that you lead at the highest levels of academic neurosurgery, I'd like to take you back to your early years in training. If you could give advice to yourself as a resident or even as a medical student, what leadership skills would you tell your younger self to start cultivating sooner? Thank you.
I'm not sure that I would say there were leadership skills I would have said to myself when I was a resident, because I don't think as a resident I imagined that this was the path that I was going to take. I wanted to get by. I wanted to be a good surgeon and clinician so that I could take really great care of my patients. And for me, the biggest thing was holding true to myself. I was different than, I was my own unique individual, as every single other resident was. I just happened to be one of only two who had graduated from my program in a very long period of time, stretch of time. So it was a little bit of a different environment, but one in which the challenges really helped me grow. And as I look back on that time, the times as I, stayed true to myself, what was important to me, how I carried myself forward, those were the very beginning sparkle dust of, the formation of the leadership skills that I was, developing.
Thank you.
So, Dr. Eyre, following up with what you just said about your initial beginnings with residency and your thoughts of leadership then, I want to hear from you now. So during that transition from residency to becoming a department chair, how did that concept of leadership evolve for you?
Yeah.
And perhaps, like, what do you wish you had understood about this idea of leadership earlier in the career as you transition into your position as a chairman today?
there's such a big gap in time between leaving residency and becoming a leader. So I think it is a stepwise progression. There were a lot of opportunities that were presented or that came by, not necessarily all things that I was searching to do, trying to find to do, but opportunities that when presented, I decided to take the leap. And the biggest part of my leadership journey, I think, has been being open to a wide variety of opportunities. And then as time went on, and learning greatly and very different things from all these different types of opportunities, but following through. So in terms of developing the leadership skills, any one of those opportunities that I said yes to, I followed through. And those are the stepping stones that then opened additional doors that then allowed new and more challenging opportunities to come forth for me to choose. And then as time went on, you know, when you follow through, when you do a good job, when you contribute, naturally you will get more opportunities. And there became a time where I needed to sort out which of those opportunities were in tightest alignment with me, who I am, what I really enjoy and feel like I can contribute, and again, being true to myself. So there came a time where I recognized that there were certain opportunities that I learned a tremendous amount from, but it was time for somebody else to carry that mantle and to start moving it forward and lean and spend more time in some areas that meant more to me. So I would say in that progression, that span of time of development, it is about, again, people aren't going to give you things you haven't earned. So you do need to earn it, and you need to follow through. If you can't do something, it's not the right time, not the right situation, that is entirely fine. Be upfront and honest about it. And sometimes if you have the bandwidth to do it, jumping on an opportunity or trying something out teaches you something that you would not necessarily have expected, and bring up an area of interest to you that you might not have thought of.
Thank you for that. My question is on, as the chair of neurosurgery at Henry Ford, you're tasked with not only patient care, but with also shaping the department's culture, research profiles, and education mission. Could you walk us through how you set strategic goals, build consensus among faculty and staff, and ensure long-term vision is actually being carried out across such a large academic and cultural enterprise?
Yeah, I have to say that is in active evolution. And I am fortunate that I came up through the department, one that has been a stable department for a very long time. So coming into it was a great opportunity to build on what has been again, a long-standing solid foundation. The challenges and the way forward have come from just changes in healthcare. We're all being pressed to do more, and with fewer resources, with less time. Also, the expansion of our health system, adding most recently in the last year 8 more hospitals, 7 of which do perform neurosurgical services, and also becoming a department at MSU. So it is very multifaceted, and what I have leaned into there has been all of the fantastic members of this department. I cannot do all of it. I shouldn't do all of it. And everybody in this department has significant talents. So supporting them in their areas of expertise, their talents, giving them the support and runway to do those things, is both maintaining a positive culture. There again, this is you just can't do any of this alone. So, and it also provides a really good balance. Sometimes as neurosurgeons and physicians in general, we've kind of been habituated to, you should be able to do everything and be perfect at everything. And true leadership, if you look at programs and books, etc., true leadership is about building a team where multiple strengths complement one another. And so for me, that has both supported the culture that was here and pushing that forward, and also supported the growth of the department and how it is that we navigate new challenges.
Thank you for that elaborate response, Dr. Eyre. So as we know, leadership in academic medicine often involves constant decision-making, public visibility, and the weight of responsibilities. How do you cultivate resilience personally and institutionally? And what leadership philosophy has helped you prevent burnout while sustaining long-term impact?
I'm going to be perfectly honest. I am not sure that I am the best spokesperson for maybe for resiliency. I'm not sure about for preventing burnout. I just want to make sure that everything gets done. So for me, the resiliency is supporting everybody, and when things continue to move forward, that fuels me. And when I see the accomplishments of the members of this team, from the accolades of medical assistant all the way up to, I just got an email earlier today that we had hit a milestone of collecting our 6,000th brain tumor sample in our brain tumor bank, which is the 3rd largest. So all of those accomplishments really do fuel me and are part of my resiliency. For others, I recognize that they work differently than I do. So I try to cultivate that by touching base, making sure that I've made direct connections with everybody, with, just taking the pulse. How are things going? What's going on in your life? I know that such and such is coming up. Have you planned, let's make sure your knee surgery, or I don't know, gosh, all kinds of things come up, right? This is coming up. Can we make sure that we've got everything lined up for that? So I think that recognizing how everybody else works optimally and trying to, you do have to maintain like a standard, right? Everybody, whatever the expectations are, but give people the freedom to work within those maintaining of expectations, and then support the other factors that are coming at them.
Thank you so much, Dr. Eyre. I wanted to make another question to you. How do you define personally the success as a leader in medicine? Has this definition shifted across the years, and how do you think the next generation of physicians should rethink traditional notions of achievement and leadership?
So I want to make sure that I've captured what you've asked. So you're asking, how do I define success?
Yes, and if it changed across your medical career as a definition, and what should be...
Yeah, no, it has absolutely changed, and it will continue to change. And I think that my definition of success has not only changed for me, but it is different than the measure of success for many of those that I work with, and it should be. To me, that's actually part of the success. How I define success is that so many members of our team are reaching what they want, right? They're growing, they're, achieving that next milestone, and that will look very different for each individual. If I had a residency program, I've said this many times before, particularly during residency interviews, if we had a residency program where every single person graduating from the program went into a very cookie cutter, same mold of one another of the type of practice, you know, even if it varied by subspecialty, the kind of practice that they were going into. I think I would feel like a failure, because we need that diversity of approach to patient care. So I keep that's aligned with how I feel about success. So for me, it is seeing the various members of our team, certainly as somebody in the institutional leadership, not just the academic department leadership, but the health system leadership. I do have to look at things like volumes and efficiency, and to me, most importantly, quality. So success for us also means putting, you know, getting the best quality care to our patients and meeting their needs. So I feel like I have definitions of success that are in stuff, you know, different realms. And I'm sure that there are times where I thought a definition of success was, you know, like, oh, we have to have, I don't know, from a hospital, right? They would love if we had the biggest market share. Is that to me the end all be all? No, having the highest quality, the place where patients want to come to, the doctors that are the named, you know, the people that patients think of, that to me is most meaningful, because it means that our team is shining. So our definition of success, and I'm sure it'll change again next year by the time whatever the next challenge comes forward. Sometimes success means surviving the day, and that's okay too.
Thank you, Dr. First, I would like to remind the audience that if you have any questions for Dr. Eyre, please use the raise hand feature and also submit your question in the question and answer box so you can ask your question directly. And now moving with the questions, what first inspired you to choose neurosurgery and later to focus on functional neurosurgery? And as you have taken on senior leadership roles, such as program director and department chair, how have those early motivations evolved? In other words, how has your personal why shift over time?
Yeah, I will admit I had a lot of medical exposure in my family, and I was absolutely the biggest science geek, you know, science club chair, whatever it is you want to call it. So I was definitely somebody who both geeked out over science and also liked manually doing things. My dad always had a little area in the basement where he would fix things and develop photos and whatever, and I was always down there with him. So that mixture of the science and the wanting to do something with my hands was, I think, always innate in me. And I was granted some amazing opportunities as I was actually in the end of high school. There was a former teacher in my high school who had moved to working in a research laboratory, and her boss was willing to have a student come and, you know, like wash dishes and start helping out with some side projects. And the people in science club, I was the one person who was going to be able to make that work. So it was just completely random that I was able to take that opportunity. But that turned into summer after summer during college doing research. It turned into the opportunity to work in a professional lab while I was in college, and all of these had a strong link to neuroscience. So ultimately, as I was coming into going to medical school, which I knew I wanted to do, my mentor that I'd spent all those summers with said, I really think you should stay in research. I know I can't talk you out of medicine, but will you consider the MD PhD program? So I started exploring that and was fortunate to find a program at Cincinnati that was aligned with what I felt like the right thing. Things have changed quite a lot in MD PhD programs. Way back then, it was really geared towards people who were going to 80% run a lab and jump into the clinic every once in a while. There were relatively few surgeon MD PhDs. There are obviously way more now, and the ones who were in training at the time that I was have really been able to come into greater success. So the environment has shifted, but the this program did not bat an eye when I said I still think I want to go into surgery. And so it also just made it very easy when I came to how do I want to do, what area of research do I want for my PhD? Well, I was very simplistic. I went through all the program books and I dog-eared everything that looked interesting to me. And then I looked at all the books at the end, and the neuroscience book had like everything dog-eared and like 2 or 3 things, and all the other books. It's like, well, decision made. So I think it was finding what resonated with me, leaning into that. And then, so if you just kind of think about those pieces, yes, neurosurgery was in mind, but then I started on the clinics and got to see patients in the operating room. And you think about functional neurosurgery and a patient who's just like shaking all over the place. And then you turn on the electrode and they go, I mean, it's still stops me, even though I've been doing it for, I don't know how long now. So it's been a match of, you know, all the things that really drive me, and then the inspiration from the patients. And I still take that inspiration from the patients into all of these leadership roles, because ultimately, while the number of days in the operating room are going to come down for me a little bit, I'm still going to be doing that. And everything else that I'm doing outside of the operating room is so that the rest of our team can be the most effective at providing the best care for the patients.
Thank you, Doctor. We have a question from Melek. You can ask your question directly.
Thank you. So, hi, Dr. Ayer. I think your career is highly inspiring, and I'm currently a medical student, and I have a strong interest in neurosurgery. And my question is, I was wondering if you allow students to shadow you or observe your work to gain more exposure to the field, and if so, what's the best way to reach out or get involved with this?
Yeah, so I certainly have. We at our institution have a large number of medical students we work with from a couple of medical schools. So the institution has basically, so we need to give priority to those students. I think there are so many individuals out there who are very happy and willing to share their experience with neurosurgery, and so finding individuals that are near you is I think if you reach out to them, they're going to be happy to work with you.
Thank you, Dr. Ayer. And just to emphasize that we encourage those participants to continue asking questions. Kind of tailing off to another direction is, you know, as the years are going by, the way we deliver healthcare is changing, academic medicine is changing, and I think all of those are impacting neurosurgery in a big direct way. Especially with new technologies coming out, patient demographics are shifting, and we're having this big corporate administrative pressure, I think, on hospitals and departments in a certain way. So I want to hear from you as someone who is in between those two directions of business and those kinds of models and in hospitals. How do you navigate these like transformations and like kind of balancing the need for innovation, also trying to preserve those core values and like the responsibility with patient-centered care, surgical excellence, and trainee development as well?
There's a cartoon that I have in one of my slide decks that I come back to often because it, I think, reflects a lot of things that you're asking about. And it's somebody saying, who wants change? And everybody in the room has their hand up. And then it's followed by who wants to change? And nobody has their hand up. That is a struggle that we are all dealing with as surgeons. We have decades and decades of being the big dog, of, you know, being able to have a very heavy hand in how things go in our hospitals and, you know, situations. We are taking tremendous risk, and rightly so. There's no real way to compensate for the fact that all of us are taking this level of risk on a regular basis. And so asking a surgeon to change when they feel like they've gotten to a good place is a big challenge, because their worry is, am I going to continue to provide the same amount of care or same level of care? That being said, surgeons, and particularly neurosurgeons, I think, are also technology geeks, and so like to be able to push the envelope and be the ones driving some of that change of incorporating new technologies and ways of approaching things. The juggernaut there is all of these other forces that are around us, as you mentioned, and sort of the, I don't know what you call it, the healthcare industry. So on one hand, the United States is a tremendous driver of innovation in healthcare. We also spend an ungodly amount relative to our outcomes. And it is really, I am hard pressed to say that we are absolutely the ones doing it right, when there are so many countries around the world that are ostensibly providing, really definitely providing the same, if not better, outcomes for a much lower cost. So that is a reality that's kind of coming home to roost in the US, and more forcefully in the last number of years. I think that drive is going to continue. And my hope, as I work with my colleagues and try to advocate nationally, is that we remain the ones driving the change, that we step back and look at it and say, what should we need to do differently, so that we're out in front and not reacting to outside forces telling us we have to do something different. We're doing that very actively here at this institution, and kind of empowering the surgeons as much as possible with the information about, their quality, the cost, all of those things, so that they can optimize care. And a lot of our decision making across the groups is shared decision making. It's being driven by the surgeons who are in front of the patients. So I think that is critical. If we sit back and wait and complain and be the people who say, I don't want to change, while wanting change, then I think we're going to get steamrolled. So that is one message that I definitely try when there's the opportunity to get out there. At the same time, my team members will tell you that I'm pretty blunt about what the outside forces are. And just because we want to be the ones who are out leading, I think in order to do that best, you have to be very clear about what they are, and not, just be dismayed that that's the way the world is going.
Thank you for your insights, Dr. Ayer. I think that message is very important to take home. So my question is, you co-authored the landmark professionalism policy for neurosurgery conferences aimed at setting new norms around respect, inclusion, and accountability. Why do you think culture building is a leadership responsibility? And what advice would you give younger physicians about cultivating ethical leadership in environments where culture may be slow to change?
If you are only getting the opinions of a small percentage of the people who are involved, you are not seeing the full picture. And having an environment that promotes anybody and everybody's ability to step forward and say, I have an idea, or I'm experiencing this, is critical. The professionalism policy that you mentioned was certainly a labor of love, but getting back to the conversation about how I got into some of this and some of the steps in my leadership journey, that was truly one of them. I was a WINS officer at the time that some challenges came up, and was the right opportunity to, I was asked to collaborate with the main societies of neurosurgery to say, how do we do this better? And fundamentally, it came down to, can we have an open exchange of ideas at our meetings, right? The whole idea of our meetings are for people to bring what they're doing, new ideas, and bring them forward, discuss them, vet them, you know, poke holes, take the best parts. How do we move it forward? And if not everybody feels like they can participate in that meeting fully and as themselves, then we aren't getting all of those ideas. We aren't vetting the ideas that are out there. That's the core of that professionalism. And I think if you view it that way, rather than view it as, you know, just about harassment or whatever else, then you put yourself in the position of saying, I feel like I should be able to bring up my ideas. I feel like I should be able to question if that's the right thing to do. That everybody should be able to feel that, then it's a very different conversation than if we just think about it as somebody saying, oh, well, I shouldn't say this or that or whatever at a conference. It's, you just want to be able to be part of the full conversation. So I think that is true across all elements of being in medicine. I am sure that there are times that I have tried to mold somebody into maybe reframing something that didn't necessarily come across as the most inclusive. And I'm sure somebody could view that as trying to squash, but I think that the conversations, the way that I try to have that conversation is, again, to think about it from the perspective of the person on the other side. And that is part of leadership. Again, I feel like I've said this several times already, right? If I am not capturing all the different perspectives, then I have a big blind spot and I can make a big mistake. And I'm not saying I necessarily capture all of my blind spots, but at least I try.
Thank you so much, Dr. So we have another question from the audience.
Hello, first of all, thank you for the opportunity. My question was how important do you think advanced imaging or like surgical or let's say technological innovation are in detecting Alzheimer's earlier or monitoring the disease as well as all the neurodegenerative diseases, and also based on your, let's say, view on the future or vision overall, how do you see neuro research evolving in the coming years as we see new research coming up every day? Let's say every day, but really often. Or maybe what would you like to see? What's your hope for something that would be the reality in the future? Thank you.
Sure. Things are changing so fast, and the information that we are gaining from research, from imaging, from monitoring individuals is changing the way we look at things. You brought up Alzheimer's, and we're now in a situation where there are some new treatments for Alzheimer's. Now that's primarily treatment that my colleagues in the neurology world are managing. And what they will tell you is the greatest impact that one would have using those treatments is at a much earlier stage than most individuals are seeking treatment. So we are in a mismatch of innovation that's out there, that's available, could be helpful with the community that may or may not know about it, may not know how to access it, payers who may or may not support it. And that, I think, those practical considerations of how we understand neurologic disease in particular and how we develop treatments for them is one of the biggest challenges. I think that there's a lot of fantastic research going on brain tumors, dementia, movement disorders, epilepsy, all of these areas, I see more and more trials that are going to be coming forward for stem and cell therapies, infusions into the brain for treatment of disease, of neurologic diseases. So the science, it's not perfect. We don't have every answer, but the science is moving. It's going to be translating that science into patient care. And again, this is where our advocacy as physicians is going to be really critical, because there's going to be that push-pull of we're going to invest in these things now. We have to make the argument, we have to prove that that earlier investment is going to be worthwhile down the road, and not just we all got a flashy new toy and we want to use it. So I think that's where the crux of the challenges going forward on bridging that innovation into patient care are going to be. I think the tools are rapidly expanding.
Thank you, Doctor. So now moving into a very important topic for our audience today. So mentorship is often one of the most defining parts of a medical career, shaping not only how we learn procedures, but also how we grow as physicians and leaders. Looking back at your own journey, who were the mentors that most influenced you, and in what ways did they shape not only your technical skills, but also your values and perspective as a neurosurgeon?
You know, for me, my earliest mentors in many ways are my parents, right? My father is a now retired orthopedic surgeon, and he was very different than his partners. I can give you all the ortho bro memes of the stereotypes of an orthopedic surgeon. He had several partners who lived that out, and he was always the quiet, smaller guy. But when he said something, people listened because he only dug into things, or he only really said, hey, can we talk about this, when there was something that really, you know, was going wrong. And that taught me a lot about how I work with others. And he spent a lot of time listening. So I still take that into my day-to-day. I certainly take into the operating room. What are the things that I am, you know, we could do this 1 or 12 different ways versus right now is a critical moment. So that, and then my mother, who is just a strong professional woman and has always tried new things. She's evolved her career over the many years. So those were my foundational mentors. I know that there's a great tendency to try and find mentors that you think are going to fit with you, or you feel like are missing something, or not, that went through a struggle that you are, and all true, but mentors come in so many different forms. I would say some of my strongest mentors have been men. Somebody who has said, who's just given me the opportunity and said, hey, you know, if you consider this, if you consider that, think about this, that really drove me to, you know, shape how I moved forward. So looking for, or taking on mentorship where it is very important. Probably the strongest mentorship relationships are the ones where you have that relationship. It's not a I've just scheduled a meeting kind of follow through, but you've have some rapport so that individual can get a sense of who you are and what drives you, so that they can help make suggestions. I think the other thing to for me that has been so critical is looking beyond, and I'm sure I'm not the first person to say this on these webinars, but is to look past mentorship to sponsorship. Mentorship is giving advice, you know, helping to guide. Sponsorship is putting somebody forward. And that goes all the way up and down the scale. I have seen this tremendously in the WINS organization as an example, where the residents are helping the medical students make tremendous moves in what it is that WINS does as an organization, because they're saying, hey, this team has got a great idea. We've got to act on this. That's sponsorship. And when you have that opportunity, one, recognize it when it happens to you, and be outwardly clear about thanking for that, because some people may not realize that's what they're doing. But also when you have that opportunity, and sometimes that opportunity to sponsor can come because you think, gosh, somebody asked me to do, like, so, you know, we had an email in my system that came out. They're trying to understand who is the best AI champion for each department. That email came to me and I immediately looked at that and said, not it. It's just, it's too many things right now. I don't want to, not my thing to dig into. I understand it. I'm really glad there are people in my department who do. I am actively saying this is the right person. And even if that question had come to me and I was just another colleague, right? If I was one of the many staff members and somebody came to me and said, hey, will you take this on? I think I would have absolutely said, this is the person who needs to do it because they're the right one for the job. So sponsorship can go in multiple directions, and sometimes that is helping your colleagues.
Thank you. And also, as a mentor yourself, and also a national leader in neurosurgical education and fomenting sponsorship, what principles or skills do you try to instill in your trainees so they can one day lead with both competence and compassion?
There's so many, and I think part of it is helping bring forward the things that they are really skilled at. Fundamental things are, people are going to look at you for a leadership role, follow through, not flaking, being trustworthy. If I can't get to something, I can't accomplish it, that's okay. Admitting that, saying it, and doing what needs to be done to help ensure things move forward, even if you no longer are able to do something. So those kinds of things, being, like I said, trustworthy and following through, and communicating is so important. And being able to communicate ideas in a way that also brings forward other people to be part of the conversation. If you, I mean, my team will tell you that I will tell them what I think and direct about it. I also try to separate out, I may be falling here. I want to know what everybody else is, or I was surprised, instead of saying, why the hell did you do that? That was unexpected. Tell me more about what was going on when that happened, right? Sometimes it's little things like that that invite people to the conversation, that also make them feel like valued members of the team. And I think when I see people who are succeeding in leadership, there is a significant element of that, not just, it is not somebody coming out and saying, I am the best leader there is, everybody just needs to follow me and do what I say, you know, get on board. And you know, the generations don't support that anymore.
Thank you for that. My question is, many students find it challenging to identify the right mentors. From your experience, what distinguishes a truly transformative mentor-mentee relationship, and what should students be looking for when they try to build those connections?
I think it really is getting to know somebody, and sometimes it is a connection that you might not, you know, expect. It's something else that you can talk about. But for somebody to really, you know, to support me as a mentor, or for me to support them a little bit more than the factual, you should take these rotations, then you should try and do this order of, you know, sub-Is, you should apply to these places. That is advising in my mind, not mentorship. Mentorship must involve listening to where the mentee is and trying to help them get to where they want to go. It does require, and I will say, as somebody with a calendar that looks pretty ugly, I still try to do what I can, but I cannot be the one chasing that, right? So if I've made a connection with somebody, I will admit, I say, okay, then I need you to circle back with me in this time frame. I need you to, you know, do this in order to make sure we keep on track and we keep in touch. So finding that, seeing who it is you connect with, and sometimes that person may not be in the area that you thought they would be in. You know, I have one of my greatest mentors, and certainly right now, one of my greatest mentors is a otolaryngologist, right? It's not my field. Yes, it's adjacent, but it's not, but the things that she's mentoring me on are around other things that we can connect on. So I think having I think it's a bike racing term called a sag wagon, that it's the cart that goes behind you that has all the things that you might need to be able to make it all the way through the race. You know, the replacement parts, the tools, the whatever it is. And so many years ago, someone introduced me to that concept of a sag wagon. Who is in your sag wagon? And it's not one person. It's somebody who can help you in this realm, somebody who can help you in this other realm, that sort of thing. And if you view that as an advisory committee to your life, that's the most beneficial.
Thank you so much, Dr. Air. I wanted to ask you a question. Since you've been president of Women in Neurosurgery and advocate for diversity and leadership, what structural changes do you believe are needed to advance women and underrepresented groups into visible leadership roles in medicine?
I think it's been happening, right? I mean, which has been great. I think that mentorship, sponsorship, just being out there and having there be, you know, I was kind of taken aback a little bit at the slide you had up at the beginning with all these various things about me, and that what percentages of board certified neurosurgeons are women, and being the 5th chair of an academic department in the United States. Those have already changed. I've only been chair for 2 years. Those have already changed dramatically. We're pushing the 10%, I think, on, I don't even know. I have to get the most recent numbers, but in terms of how many are board certified, that number has already increased a couple of percentage points. We're up to, I don't know, 8, 9, 10 or something of female neurosurgeons across the country. That's just in 2 years. So there's some momentum that comes along. We also, and I saw this again on the slide, we were bottom heavy in terms of women coming into the field, and meaning more of us are at more junior parts of our levels of our career. And so that will take some time to work through. But if you see the pictures, the department photos of neurosurgery departments these days, they are so different than they were 20 years ago in an inspiring way. And it's not just a gender thing, it's in all different aspects. And that enriches us as a field. So I think that will just, when people are experiencing that enrichment, they experience, you know, that they're getting something different from their career by having a wide variety of voices. I think that just perpetuates itself.
Well, we appreciate you sharing that, Dr. Ayer. As someone who, my mentor is also from University of Cincinnati, and she's also female just like you, so I'm very honored to have the kind of lineage of folks coming and helping to teach me as well.
Do you work with Dr. Nguyen?
So I've worked with Dr. Starman, so she's a younger.
Great,
Starman.
Fantastic. I know her as well. Wonderful.
Yeah.
Great mentor.
And so as someone like you has kind of mentored like I wouldn't say generations, but shorter time frame of generations, if you want to call it. What have you learned from your trainees or your junior colleagues that kind of has shaped the way that you lead today? And do you think that leaders like you should kind of practice this idea of like a reverse mentorship, meaning learning from your colleagues to kind of shape you and shape how you interact with others in the future?
I am learning from those junior to me in many, many, many ways. And I will admit, you talking to the generational thing, yes, I've been doing this for a while. I'm not horribly old yet. I'm getting there. I'm trying. I'm not horribly old yet. But the environment of what the expectations were for showing up at work, being, that it was okay that somebody threw an instrument in the operating room, like those things were still okay when I was a resident, and that is just not anymore. So those are things that are tremendous improvements. On the flip side of that, I think we are struggling as a field and as a profession, as physicians, with the reality. COVID brought it forward. So many other things in life have brought forward the avoiding burnout, work-life balance, being able to be a multi-dimensional human outside, not just at work. Also important, but in our profession, in any surgical profession specifically, I think there are some core things that we're struggling with that I don't know ever should go away, right? That, if I operate on somebody, that's my responsibility. I can't walk away from that. I can't say it's 5 o'clock, I'm done, I'm leaving. So I think that's where the meetings of the generations is something that we're still in the process of working out, of saying, how do we both be good to ourselves and each other, and recognizing that we all need things outside of our careers and outside of the hospital, but making sure that our fundamental responsibility, like tremendous weighted responsibility that people give us to help care for them, is still kept very sacred. So I think we are getting there, and we're viewing how it is that we give care in that lens differently. Patients feel it though. They are, and I think that patients, as somebody who now goes and sees a physician, I want to be catered to more. But as a physician, I'm feeling stretched on catering to patients more. So we're all in this give and take that will eventually work itself out. But I think it is the best opportunity for, I do feel like sometimes I'm sitting there going, oh my God, I walked uphill both directions in the snow, when I don't really mean it to be that, but I'm personally trying to reconcile those worlds. So I think that there's going to be ways in which we all teach each other how to do it better.
Thank you, Dr. So as our final question now, can you share a clinical case that not only reaffirmed your choice of neurosurgery, but also taught you something about leadership, whether it was about decision-making under pressure, guiding a team in crisis, or supporting a patient and family through uncertainty?
That's not fair. So I will, so this one is very fresh for me. And I think I am still learning from it. I worked with an individual with severe facial pain, trigeminal neuralgia, and just terribly, terribly severe. And during the course of surgery, we encountered some bleeding, which happens. We manage it. But there was a part way through there, I was thinking, this is like, I have it under control, but every time I try to go to my next step, I lose a little control. So trying to balance that back and forth. And I made the decision to call one of my partners. He's like a decade junior to me. But at that point, it was, what is the right thing to do for this patient? And if I had sat there long enough, obviously I sat there long enough, because by the time he came in, then everything was fine. Right? I probably needed the extra 10 minutes. But so obviously I would have been totally fine. But at some point, it was knowing that for the moment, asking for help is an okay thing to do. And, I actually said that out loud. I had a resident with me, a junior resident with me, said, I'm going to ask him to come in. I want a fresh set of eyes to look at this situation. And, the patient has done well. Just talked to her today. Her face pain is gone, but because of that bleeding, she struggled with some other side effects that she's still working through. But I gotta tell you, to have somebody say, okay, so this is getting better, I'm working on this, as long as my pain is gone, I can deal with all of these other things. And I'm thinking, wow, you are a trooper, because so many people out there would have just focused on the struggles that remained that they were working through. So I think for me, there was a lot of growth in that from the patient of how she viewed things, and how much I respect how she's recovering, but also to just be able to sometimes step back and say, I can't do this all. I mean, yeah, you probably can if you're forced to, but I don't think there's a harm in asking for another set of eyes.
Thank you,
Thank you all.
Doctor, for sharing this experience and also all your wisdom with us today. We got an amazing evening, and we are so honored to have you here with us today.
Thank you
And
so much.
also,
This has been wonderful.
thank you so much. And thank you also to everyone who joined. You all have a great evening, and we hope to see you soon. Okay.
Great.
Bye,
Thanks,
guys.
Sarah.
Thank you.